Good evening, ladies and gentlemen. Our parliamentary representative for St. George Northeast, Honorable Ron Redhead, welcome to St. Paul's. Welcome to all of you gathered here for a very important forum this evening. It is just one little pity that we didn't have the hall full, as is per usual when we have forum at this center. Nonetheless, we are in for a very important treat as we discuss the issue of vaccination and as part of Vaccination Week, which began on the 24th of April and will culminate on the 30th. Very knowledgeable panel who will share with us all the issues that we need to know regarding vaccination. Now, we do know that over the years, we have been told, we have learned that over the last few years, vaccination, especially childhood vaccination, has begun to decrease among our population. All of the people around my age know that we couldn't even go to school unless we had our vaccination. But now we are so much wiser and we have so many rights and choices and so on. We are refusing vaccination to the detriment of many of us. Hopefully tonight our panel will reverse that trend and we will continue to see the importance of vaccination. We will begin. Normally we begin with prayer, but I didn't identify anyone, so God be with us. He will guide us through this meeting this evening. So we will begin. We have with us Dr. Ari Charles. He's a PAHO consultant. We have also Dr. Kobe. I guess you could just raise your hand, let them see who is who, right? That's Dr. Charles right here. And he'll be the first to address us. Then we have Dr. Kobe Jackson. She's a PAHO advisor on immunization for the region. We have Dr. Taisha Donald, whom we all know as a daughter of the soil of St. Paul's, right there. We have also Nurse Hannah St. Paul. She's a senior community health nurse, and she is the immunization manager, very hard worker. And we have Miss Roxanne Bowler, who is a parent, and I'm sure she will share with us her perspective as a parent of a child who has been vaccinated. We will begin with Dr. Ari.
Just the reading, okay. Okay. Vaccinations, I'm sure looking at, I saw a small boy, he must have left, but I'm sure most of us are above 30, except you. Most of us are above 30 years, except you. Mm-hmm. And the very old ones, I'm sure, should have this mark, huh? Yeah. This is a sign of the wealth our parents built for us. Reason some of us are still waxing very strong. And unfortunately, this wealth that was built by our parents, who many did not even go to school, we are trying to destroy the wealth, creating poverty for our children. So, what is immunization? We always use the word vaccination, immunization interchangeable. But there is a difference. One is the process, or both of them are processes, but one is the act of doing, and the other is the results or the benefits we get from the act. So vaccination is the act of immunizing. Immunization is the process of stimulating or preparing the body to fight against organisms that will harm the body. like viruses, like bacteria. So, one of the ways we immunize is to give vaccination. Another way you can be immunized is to get the disease. If you've had chickenpox, you will not have it again. So, and a booster dose, you must have heard when you carry your child or you go to the health facility, they say you will come for another dose. That's a booster dose. It's like, the booster dose is like, it improves your immunity. It's like we have this house, we are secured because of the immunity we have, if I want to use this analogy, is the wall. If we think thieves might attack, we put a fence. Another booster will be the dogs. That's the immunity we are building. So, how many doses must a child have for us to say the child has completed the vaccination schedule? At birth, we give BCG, which protects the child against tuberculosis. Then we have Penta. Penta is a group of 5 different, it's a vaccine that protects against 5 different diseases. So we give at 2 months, 4 months, 6 months, and a DPT booster at 18 months. I'm sure the pediatrician will come to greater details. Then polio is given at 2 months, 2 months, 6 months, 6 weeks. Sorry, the calendars, the schedule varies from country to country. In Grenada is given at 246. 2 months, 4 months and 6. Okay, I thought I made a mistake. So MMR, measles, mumps, rubella at 1 year and 18 months, the second dose at 18 months. Then the second booster of DT, that's, I hope, is it the same? At 4 years? Okay. Okay, the third booster at 14. Then HPV as from 9, the age 9. Another thing, very important thing about immunization is the immunization report card. The booklet, it's a report card. It's proof of the vaccines that the child or you have received. So, it is as important as the child's birth certificate. Health records are very important to keep. Please keep them, because we've had problems when children go to school. Some universities insist to have the immunization record or the status of immunization status of the students. Always move with your child's immunization record. When you change town, you change country, please have it. The health workers who are here, please always update immunization records. We have immunization registers, we have tally sheets, we have health information management systems. Please, health workers, always update. Pediatrician, update, please. Always tell the caregivers the vaccines their children are receiving. And to the parents, always ask to know the vaccine you're giving your child. It's your right to know what. All doctors make prescriptions, right? So it's a prescription. Doctor, what is my child going to receive as vaccine? They'll tell you the name of the vaccine, how it, the route, whether it's oral or injectable. They will tell you. Always ask health worker, always tell the parents the date for the next appointment. Also ask your health worker the date for the next appointment. Because at times we forget. So, why is it important to immunize children? To protect them from dangerous childhood diseases and their complications. So, these are some of the complications of vaccine-preventable diseases: paralysis, blindness, deafness, destruction of the ears, mental disabilities, malformation of newborn children, cancer of the cervix, also cancer of the liver, and the last complication. So, if we start with polio, this is how a child with polio might look like. You see, the muscles of the limbs are wasted. The Caribbean is known for the successes that athletes have brought to this land. You know some of the names. So we want our children, even if they become pilots, they should be great athletes. Do we want our children to look like this? Do you know the burden having a disabled child? We are all parents with children. The burden. We don't want our children to look like that. I'll go back to that slide. That is a complication of poliomyelitis. It is preventable with few drops of oral polio vaccine and injectable polio vaccine. Complications of measles. Measles is a vaccine-preventable disease. It can result to blindness. It can result to brain damage, encephalitis. It can cause deafness. It is vaccine preventable. I gave you the immunization schedule for measles. The vaccines are available for free. Congenital rubella. We insist that children should be vaccinated. Not because we want to protect the children, it's because we want to protect not only the children, we want to protect the family. If a child is not vaccinated against rubella, and this child goes to school to meet the young female teacher, for example, who is pregnant, and it happens that this child is contaminated with rubella, this pregnant teacher or the pregnant nurse, young pregnant nurse, might become contaminated and might end up giving birth to a malformed child. Your wife gives birth to a child that is malformed because of rubella, which is vaccine preventable. That woman is not happy. to have in her hands or in her palms a malformed child. The father of the child is not happy. The family, both families, the wife's family, the husband's family, it becomes a community problem. That's why at times when people refuse to take vaccines, they don't know the implications. Because I refuse to be vaccinated, it might affect my neighbor. Complications of human papilloma virus. For those of you who are not people in science, this is a cross-section of a woman. If a woman is pregnant, the baby is in the womb. The baby is in his or her house, inside. The womb is the baby's house when a woman is pregnant. And when a woman is pregnant, the door, the house which is called the womb, has a door. The door is locked so that the pregnancy does not come out. It stays there till 9 months when the baby is ready to come out. That is where the virus attacks, the human papilloma virus attacks the cervix. And when it attacks the cervix, it can result to cancer of the cervix. So these pictures are pictures of the cervix. This cancer is vaccine preventable. This is the vaccine we give from age 9. It's given for free. All of you must have done small businesses, and you understand English. You say, being penny wise and pound foolish. The vaccine is free. You refuse to take it. When cancer comes, the cost of cancer, for those of us who've had family members with cancers, different kinds of cancers. So, one of the complications of vaccine preventable diseases is cancer of the cervix. If you look at this photo, this is a child with neonatal tetanus. On the left is an adult with tetanus. Tetanus can be prevented if we receive tetanus vaccines, which we usually and we always give to pregnant mothers in our health facilities. The tetanus vaccine that we give to pregnant mothers protects both the mother and the unborn baby or babies. It's given for free. Les, how much do you tax for tetanus vaccine? You don't take money? I thought she was taking money, so I would have held her. What are the benefits of immunization? I decided to start with the complications so that if we had time, I would have asked you the benefits. But because we do not have time, I'll list the benefits. One of them, you look at this pretty baby smiling. She is receiving and she is happy. I want us to look at the photo. We have unvaccinated children, which these are the unvaccinated children below. And these ones above are vaccinated. They're smiling, they are strong, they are playing. These ones are hospitalized. The benefits of vaccination did not begin today. Most of you must have heard of the story, the disease that existed long in the 60s, smallpox. That was a success story. It has been eradicated. Some of the new biology books do not have smallpox. Teachers do not talk about it in biology classes in secondary schools today. It's long gone. But if we are not careful the way we are behaving today, destroying the wealth our parents built, we will go back to history. So, immunization, benefits of immunization. Immunization saves life. I just showed you I just talked about smallpox. It has been eradicated thanks to immunization. Immunization protects the next generation. It protects against poliomyelitis. We want a generation that is strong and vibrant. Polio has been eradicated in most countries. Today we have endemic polio only in 2 countries, Afghanistan and Pakistan. We can prevent mother-to-child transmission of rubella through immunization, so that the child, the next generation, the child that will come after us should not be malformed. We can prevent neonatal tetanus by immunizing all our pregnant mothers. Even you, the farmer, TT is very important. We work hard on farm, we take care of animals. We can have wounds that will be infected with tetanus. We keep pets, we can have rabies. There are vaccines against rabies. Immunization saves money. A poor man is a sick man, or a sick man is a poor man. Imagine your child being hospitalized for measles, meaning you have to start looking for permission. Let me start with permission from your boss to stay with this child in the hospital. You need money. If serious complications set in, the length of stay in hospital will be longer. Livelihoods will be put in jeopardy. Maybe you have a small shop and you're the only one to take care of that child in hospital. That shop, which is your source of income, will be locked up. The poverty cycle continues. But if your child is immunized and in good health, you will save money. We've talked of polio. These are disabilities created by complications of vaccine-preventable diseases. We've talked of the complication of measles. Immunization protects you, your friends, and family. We saw that with COVID. There are some people who got infected with COVID but did not manifest. They had fever and other symptoms, but it was mild. Some contaminated friends and family members who had other diseases like kidney problems, diabetes or hypertension, or because of their age. Age is a risk factor. all other methods. But most of the side effects are mild. They disappear without treatment. It can be fever, rash. They do not have long-term consequences. However, we've had cases with severe side effects, very rare cases. The advice I will give all parents and individuals: if you receive a vaccine or a medication and you react, please report to your healthcare provider. Report your side effects that you experience, not some other person's side effect. You can report that of your child because maybe the child will not know how to meet the nurse or the doctor. We don't want this situation where I took amoxicillin and I had an allergic reaction, and John reports my allergic reaction. You did not take amoxicillin. I took. Let me report my side effects. When I drink Stark beer, the joy of it, I experienced it. It's not you who drank the beer. Please, because that is the mistake we are making today. Reporting the pain somebody has wearing a pair of shoes. It's not your pain. Well, it can be your pain, but first report what you say, I saw this person who took, and help the person to report if the person cannot report. But we insist, please report your side effects. In all our health facilities, we have registers. When a vaccine is administered, we record the batch number. We record the date of manufacture and the expiry date of all vaccines. So, when we give you a vaccine, if those who have received, you see the name of the vaccine, the batch number is always written there. This is because if you react, we will go back to our records to see the vaccine you took, the batch number. It helps us in the management of side effects. So the side effects you see on leaflets of drugs and vaccine are side effects people who took the drugs or the medication or the vaccine reported. Please report. We are interested. And again, no two people will react the same to the same, will have the same side effects to the same, might have the same side effects to the same vaccine or medication. Not even identical twins will behave the same. So, I'll end here. Immunization is a right. All our children, it's the right for all our children to receive the required vaccines. It's your right to ask government to put pressure on PAHO to provide vaccines. It's your right. Government is not doing you a favor. It's your right to be vaccinated. If you didn't know, it's your right. So, the slogan, get up to date, each vaccine, and it's free. Thank you.
Thank you, Dr. Charles. Have we begun to feel the seriousness of vaccine? becoming vaccinated? Have we begun to see what could happen if we are not vaccinated? Dr. Charles opened the bat, and we're going to get much more. I've been just listening to him and making some notes. But the thing I think that stood out the most were the pictures of the effects of not being vaccinated, especially of those children. And I believe by now we all know that there are re-emergent diseases and emergent diseases. So you will hear about more and more vaccination. And we have to begin to take it really seriously. As he said, him being infected could infect his neighbor. So when your child is not vaccinated and your neighbor's child goes to school with that child, just imagine what could happen to that other child. Or make it more personal. Your child is not vaccinated, and maybe 2 other children in the school not vaccinated. But you say you don't want your child vaccinated, they're putting some chip in the child, and this is going to make them all kinds of whatever. And then your child comes down with one of these diseases. You know how much it could cost? Not just to try to get that child better, but even just for normal living, the wheelchair, the walking stick, the whatever, you having to carry the child everywhere. He explained it all. So, we're beginning to see the importance of it. And Dr. Donald, who is herself a pediatrician, who looks after children, who cares for children, who knows all about children, will bring it a little closer. Because those of us sitting here may have been vaccinated from against those childhood diseases. So we're okay. Up to now, you look at me, and yes, I'm 18 years old, but I am okay. So just imagine. So let's hear how we can get now to the roots of the children being vaccinated and how important it is to have them protected. Give Dr. Donald a warm welcome.
Thank you, Ms. Benoit, and good night to everyone. All right, so I'm going to be speaking a little bit about the impact of vaccination, immunization, in the pediatrician's perspective. And so you see I have a nice little picture here of a child receiving her vaccine. She seemed to be handling it pretty well. There's a teddy bear there, there's daddy. And I like that, there's daddy there. And this little girl is receiving her vaccine, and she's actually not handling it too bad because she has a very nice environment. So we're gonna speak a little bit on the pediatrician's perspective. So vaccination saves lives. So Dr. Edward Jenner created the world's first vaccine. Thank you. Which was successful in 1796. Now think about that. That was 1796. That was 200 years ago. And since the creation of that vaccine, which Dr. Charles spoke about, the smallpox vaccine, we've had many, many more vaccine creations, including our most recent one, the COVID-19 vaccine. Now, our childhood immunization schedule, and of course I'm a pediatrician, so I'm going to speak a little bit about this schedule. So in the Grenada's context, we start off with our birth dose of hepatitis B. So parents, all our young parents would realize that at birth, within the first 24 hours of life, baby would receive the first shot, as we would say. And I like to say the word shot because when we speak of the whole, issue with vaccination now, the coverage in our country, you know, back in the day, maybe when I was a child, a long time ago, our parents used to say, I'm going to take my child to get a shot. Now, interesting enough, most of our parents, I'm sure when my mother is here, I'm sure if I asked her what was in the shot, she couldn't say, but she knew that I had to go and get my shot. But we've become more educated, we've gone beyond that, and now we actually all have an idea of what is in all of these shots. All right? And I'm saying the word shot because back in the day, we went for our shots. We didn't go for vaccine, we didn't go to get immunized, we went to get our shot, and it was a big deal. Parents would call me as a pediatrician and they would make confusion with me. Dr. Donald, you did not call me to remind me that I had to get my shot last week. And I'll say, okay, I'm sorry, I apologize, so let's come in and let's talk about this. So the first dose in our Grenada context is the hepatitis B. And again, just to reiterate some of the things Dr. Charles said, hepatitis B is a virus, and that virus affects your liver. Now remember, we have one liver in our body, and if that liver gets affected by this virus, it can cause liver failure, it can cause cancers, and only one liver we have, so if we don't protect it, that can be fatal. Then we move along to our 6 to 8 weeks. So our dear nurses always remind parents when leaving the hospital, they remind you, remember when you go for your 6-week checkup for yourself, your baby has to get their shot also. So I'm going to use shot for the purpose of this presentation as a pediatrician. So at 6 to 8 weeks, they come trekking to Dr. Donald to get their shot. Again, I always like to explain to them what is it they're going to receive, because maybe way back when we used to just receive our shots, we didn't know what it was, but today we think information is important. We need to explain to our patients what is it that you're receiving. So at that first vaccination appointment, we do the IPV. Now what is IPV? IPV is inactivated polio vaccine, along with the pentavalent. Penta means 5, so 5 in 1. So what are the 5 things in this vaccine? And I really want to tell you them because it will help me in my next slide. So in the pentavalent, we have D, diphtheria. Now diphtheria is a bacteria that causes some really, really bad tonsillitis. And you know, growing up, we don't like this whole tonsillitis things. Parents never like to deal with tonsillitis because the children wouldn't eat, they get high fevers, they get very miserable. So diphtheria causes a very severe form of tonsillitis, all right? We have P, which is pertussis. Pertussis is the virus that causes whooping cough. And I know, we all know about whooping cough. The child would cough excessively, vomit, sometimes even have seizures, but it's a really severe type of cough. We have T, which is for tetanus, so everybody knows about tetanus, where you get painful contractures of the body. Then we have Hep B, which is for hepatitis B, so we now come into the next part of the hepatitis B series. We have H. influenza, which is another bacteria that causes tonsillitis, lung infections, ear infections. So you see, the penta is 5 in 1, and then you have your polio, so you have 6. So we have 6 things that we protect the child against. At 4 months, we do another shot, which is the same thing. So we vaccinate them against the same things as the first time. And at 6 months, again, the same thing. So basically, you get 3 sets in the same vaccines, the pentavalent with polio. Now, when we get to 1 year, we get to the measles, mumps, and rubella, MMR. At 18 months, we now start with our booster shots, which would be the measles, mumps, and rubella booster shot, and your booster shot for your polio, your tetanus, the whooping cough, and the diphtheria. Now, 4 to 5 year olds, we do boosters again. So we're doing boosters for our tetanus and for polio. And then recently we've introduced HPV vaccine, which it's a single dose between 9 and 10 for both females and males. And then after that, every 10 years, we continue to boost with our tetanus vaccines. Now, this is our standard schedule. However, there are other vaccines for covering other illnesses apart from this. And as a pediatrician, I have all of these, and I have all the others, because I believe in leading by example, plus I know the benefit of being vaccinated, being immunized, so I lead by example. So this is the Grenada vaccination schedule. Now, vaccine-preventable diseases not identified in Grenada in over 40 years. We have polio, we have measles, mumps, rubella, whooping cough, diphtheria, tetanus. And I'm going to ask a question. Why is it we haven't seen these illnesses? As a matter of fact, as a medical practitioner, if a patient with polio were to step in front of me, I may miss the diagnosis because I have never seen a case of polio in my entire career. I won't tell you how old I am, but it's over 40 years. So I gave you another graphic here of the vaccine-preventable diseases because it expands even further. Because we speak here about things like pneumococcal, flu, meningococcal. So there's a lot of other vaccines apart from the standard ones that we spoke about. But look at how many vaccine-preventable diseases we have. We have meningitis, meningoencephalitis. Now, everybody gets very scared when they hear about this infection in the brain that can kill if you didn't identify it early enough. There are vaccines that prevent against the more common forms of meningitis. All right, we have hepatitis A, which gives you vomiting, diarrhea. There's a vaccine that prevents against that. We have rotavirus. Rotavirus is actually the most common cause of diarrhea at all ages. So it's this virus that causes vomiting and diarrhea, and in some cases can even cause a little bit of respiratory symptoms as well. It's preventable, right? So we look at the little graphic here and we see how many diseases that if we were vaccinated, if we were immunized, we would have been protected against these illnesses. So it's important to remember this graphic, all right? Now, vaccine-preventable diseases identified in Grenada. So I have here hepatitis A and B, I have the HPV, I see rotavirus, influenza, meningococcal, and varicella. Now, my big question here would be, how come we see these ones? Anybody have any idea why we see these diseases or these infections? Right, because the vaccines are optional for these ones. So the percentage of our population that actually have these vaccines is minimal, maybe less than 1%. Hence, we see these illnesses. Whereas, in the other group that I showed, the majority of our population who are vaccinated receive those vaccines, and so we don't see them. So you see how important it is to know that. So the vaccines, I mean, of course, I'm going to ask the question, vaccines, do they prevent diseases? Yes, they do. So as a pediatrician, as I said here again, a lot of the diseases that are vaccine preventable, I've never seen them in real life. Never seen them. I don't even know what a person sick with polio looks like, except for what I learned in med school. All right? I don't know what a diphtheria looks like. I've never seen one. And again, this is because over 200 years we've been mastering the art of creating this type of medication to help protect us from these diseases. So we want persons to remember that vaccines, I mean, the evidence is clear. It's 200 years and counting. Everyone in here, I'm sure no one has seen a person who has been homesick with polio. So it says something, right? So vaccines do work. Now I'm going to touch a little bit on our COVID-19 vaccine, not much, because we heard enough about it for over the last few years. One of the newest vaccines on the market. Does the COVID-19 vaccine save lives? In the Grenada context, I'll answer that from where I sit, because I work in the hospital, I'm a pediatrician. I worked during COVID. I was in the COVID unit, so I think I'm in a very good position to answer that question. And I can confirm that the majority of the patients who contracted severe cases of COVID during the pandemic, the peak of the pandemic, they were either unvaccinated, or they had underlying conditions, or they were the very elderly persons. But I always remember one lady in particular, a 95-year-old lady, who was vaccinated. And I tell you, that little lady fought that disease like any one of us younger ones. But I agree. I believe that it was just because of that vaccine. So yes, the COVID-19 vaccine, it did save lives. We have a few myths regarding that particular vaccine, and I didn't want to touch too much on it because today I want to talk about the childhood vaccines, which is, the ones that I like to work with. But just to clarify a few of the myths related to the COVID-19 vaccine. So we say that it changes your DNA. The fact is, mRNA does not enter a cell's nucleus, and so it cannot make any changes. We have myth 2. It isn't safe because of a quick rollout. Was the rollout that quick? No. We took 200 years plus mastering vaccines, over 200 years. So imagine the COVID-19 vaccine was basically applying a different virus to something we already knew. So it wasn't very quick at all. Then we speak of allergies, food allergies. If you're immunocompromised, if you're pregnant, you can't have the vaccine. No, actually remember, you are high risk. So you are the one who will benefit more from the vaccine rather than someone who is well, young, and vibrant. If I take the vaccine, I'll get COVID. No. The vaccine doesn't give you COVID. What it does, as Dr. Charles would have explained, it immunizes you. So no, it doesn't give you the disease. We have 2 more myths to go through. I've had COVID-19 vaccine, so I've had COVID-19, so I don't need the vaccine. So of course there's natural immunity. The length of it, we don't know, we're not sure. But remember that vaccine does fight reinfections. And then the last myth, there's no need to wear a mask after taking the vaccine. So we dropped our mask mandates. I still walk with my mask today. But you don't need to wear it anymore. But you still need to wear the mask. All right? So these are just some of the myths related to the COVID-19 vaccine that I just wanted to make sure that I dispel. So as a pediatrician, I thought it necessary to answer this and to address this particular topic. Now, parents oftentimes would come to me and ask, Doctor, could I have a letter from you so that I don't get vaccinated, right? They would come to me for these letters. And I'm not sure if persons are aware, but we have a Public Health Act of 1980, which does allow for 2 waivers, only 2. So I want to make it public so that my patient would know which ones they could come for and which ones they can't come for. So one is religious, so you have the Rastafarians, and there's actually a group of persons who worship on Saturdays who don't do vaccines either. So these 2 groups of persons, due to religious reasons, they can receive a waiver. And then you have the medical aspect, persons who have an allergy to some component of the vaccine. These are persons also who can request a waiver. But of course, it's not you coming and telling me the story, I have to have some level of evidence. I have to have good enough information to be able to provide this document because it's actually part of the Public Health Act. And as a pediatrician, a lot of us as physicians, persons would ask us about letters to not be vaccinated. But We also have to remember that we have to maintain our integrity as healthcare professionals, so we must have a valid reason why we give the waiver. And once you fit the criteria, we will provide that letter. So the process for receiving the actual vaccine. First, we follow our national program. Then, Dr. Charles, you explain to the parents or client what they will receive and what is expected thereafter. You check your label. Make sure that you have the correct vaccine. You check your expiry date. You prepare your vaccine, and then you now proceed to administer. So you clean the site, sanitize your hands first, or you wear gloves. There are different ways you can do it. You clean the site, you inject the vaccine, you place your Band-Aid, and then, of course, you advise on what is expected after. Now, post-vaccination symptoms. So I always explain to parents that within 72 hours, within 3 days of receiving the vaccine, your child can present some symptoms. So they can have, for example, a bit of malaise, just not feeling well. They get a little cranky, fussy, crying quite a lot, body aches, maybe swelling at the injection site. And I advise them that during that 3-day period, you can use fever medication, antipyretics, things like paracetamol, Panadol, just to alleviate the symptoms. Because this can happen, we call it, post-vaccine symptoms. So we generally tell parents, if after 3 days it continues, then you would want to get assessed and make sure there's nothing else happening. But if it's within the 3 days, then it's most likely due to the vaccine. And so we tell them what to do: hydration and medication to help the child feel better. So, vaccination does in fact save lives. So let us get up to date. Vaccine counts. Thank you.
Okay, thank you, Dr. Donald. And we are moving on. Before we go further, I just want to ask you, you definitely will be given a chance to ask questions. At the end, we'll take all of them and then questions. So maybe you can make jottings as to what you want to ask and to whom, and then we'll take them all at the end. So we have just heard from Dr. Donald, and she, of course, told us all about the vaccines, the type of vaccines, the side effects, what to do, and so on. And we will move swiftly on. We have a very special lady here, Dr. Kobe Jackson. She's a PAHO advisor on immunization, and that's for the region. So we'll hear from her now, and she's going to, I guess, advise us on immunization in the region. Dr. Jackson, give her a welcoming round of applause, please.
Thank you so much for making me special. I feel so special. This is my first time in Grenada, and I'm glad to have you around and to get time to listen to me. So I'm the PAHO advisor for family health and health promotion during life course. So I start with children to elders. And listening to the panelists, Dr. Harry and Dr. Donald, vaccination is important, and we should not only talk about childhood vaccination, we should talk about pregnant women vaccination. Mothers who receive their tetanus vaccines protect their children from the womb, so it starts really in the embryonary and in the womb of the mother, this immunization that we have been talking about. So I'm glad to have you around here, and thank you for coming, because this week, the Pan American Health Organization, we are celebrating the vaccination week in the Americas, which has started years ago. So the vaccination week in the Americas, yes, has the motto that get up to date, hashtag each vaccine counts. right? And it started on the 22nd, and we end up on the 29th, but we have a big celebration on the 29th, which will be the last day of the celebration in Grenada. Every country in the Americas are celebrating this vaccination week of the vaccination week in the Americas. This is our 21st vaccination week in the Americas. It was so successful that WHO, the World Health Organization, took over as well, and they are celebrating at the same time their 12th World Immunization Week all over the world. So it's not only Grenada that is celebrating this event. I'll just give you a little bit of history of the vaccination week in the Americas, which started in 2002. There was an endemic outbreak in Colombia and Peru. So member states, ministers, including ministers of all the Caribbean countries, they gathered and they decided to start celebrating every year a week to vaccinate children so that they can catch up with those children who didn't receive their vaccines. And that was in the goal to end the measles outbreak in the region. So the first vaccination week of the Americas took place in 2003, where we had only 19 countries that participated. And since its inception 20 years ago, 1 billion people of all ages have been vaccinated. Either they received their first dose, or it's a booster, or it's a catch-up for those, especially for children. And last year, in 2022, the vaccination week of the America was a success, and we had 43 countries that participated, when 68 million people received more than one dose of their vaccine. So, as Dr. Charles, Dr. Donald give you a bit of history of vaccine-preventable diseases, thanks to vaccines, we got rid of some vaccines that they mentioned that have disseminated people, have left people disabled. We got rid of those diseases. And the number of people infected with these vaccine-preventable diseases has declined drastically in the America. Let's say, for example, in 1980, we had 250,000 cases confirmed of measles in the region. And last year, we only had 202. It's a decline, it's a success, but we still have to remain alert. As they explained, the coverage is low. With low coverage, we're still at risk. So I want to highlight here the achievements in the Caribbean region. As you all know or you have heard, the expanded program for immunization is a flagship program in the Caribbean. We are the first sub-region to eliminate measles and polio through vaccines. Very first, right? We have been 39 years free of polio, 30 years free of measles, 26 years free of diphtheria, and 20 years free of rubella. Dr. Charles explained to you the consequences of these diseases, especially rubella. A kid didn't ask to be born disabled, to be born with malformation, just because the mother didn't receive proper prenatal care, right? And the child got the disease. We need to be, as Dr. Charles said, I have to quote them, we don't have to destroy the wealth our parents left to us. We have to keep up the legacy of our parents and grandparents who accepted these vaccines. That's why we are alive today, healthy and strong. There was a risk assessment conducted for vaccine-preventable diseases in the region, and we have observed that countries and territories have the condition that will allow transmission to be maintained. That means we're still at risk, and the transmission of these diseases that we have left offshore are coming back. And we will maintain them when we have gotten rid of them 40, 30 years ago. Why? Because of low vaccination coverage. When we have a low vaccination coverage, the virus will continue to circulate. We might not see the consequences today, but our future generation will suffer from it. Grenada is not in a bubble. We have tourists. We also go for Rio Carnival. We go on cruise. So there is an exchange of people that will bring still the risk to us. And we have poor surveillance system, which means not only an immunization program, but we need to link that to surveillance. All our water wastage have to be tested for polio-free. We need to also report any case of any of these diseases being diagnosed in any health facilities has to be reported. Then we will track, we will monitor to see if it's only a single case, and if it's not disseminated in the community, and if that community is safe. There should be a surveillance system, and each country, including Grenada, have that surveillance system. But it has to be strengthened, including the immunization program. So to minimize the risk of new outbreaks, the Ministry of Health and Wellness is working closely with PAO. We are here to support the country. We are here to support the people, because we have to work for the healthy communities. We will work with the government, the Ministry of Health, to recover and maintain high vaccination coverage rates against all vaccine-preventable diseases. We will work with them for a sensitive surveillance system for timely reporting of vaccine-preventable new cases. Let me remind you again, the risk of vaccine-preventable diseases outbreak in the America is now at its highest point in the last 30 years. 30 years we have getting rid of all these diseases. Now they are our doorsteps. Things we have seen 30 years ago are coming back. I will not talk too long, but we are committed, WHO and the Pan American Health Organization, we are committed to strengthen the national immunization program so that those diseases will not come back. We work very closely with the highest political and technical authorities of our member states, including Grenada, and partners to modernize immunization programs and implement innovative approaches. We must remember that our national immunization program is our first line of defense against outbreaks. They are not here to be repeating the same thing over and over. They are here to protect us as front-line defenders. Don't forget, when we leave those diseases coming back, the road to recovery will be long, right? But each one of us, even including you here, we are all responsible to protect ourselves and our loved ones. We have to protect our communities, our grandchildren. So, and PAO doesn't stop there. We also work with the countries to help them have access to affordable vaccines so that they can give vaccine for free. We have a revolving fund that help countries to buy vaccines at a cheaper price and affordable so that the vaccines will be accessible to everyone in the country, free of charge. We can start by getting all of our shots during this vaccination week of the Americas. Those who are not vaccinated, I will invite them, get up to date. Go and get your vaccine. Get up to date. Get your neighbors to go and get their vaccine, because they are not protecting themselves only, but they are protecting the whole community. They are protecting the whole country. Thank you, and get up to date.
Thank you, Dr. Jackson. Now, we got a bit of history, eh? We heard how many years we have been polio-free, measles-free, diphtheria-free, and so on. And we have to ask ourselves, why are these things coming back? Well, we recognize the importance of this, and that is why the St. Paul's Post-Culture and Development Organization partnered with the Ministry of Health to bring the news to you. We have to continue to do what we have been doing. We have 3 down and 2 more to go. We now invite Nurse Hannah St. Paul. Well, all of them special, but we have another very special lady coming here. She is the immunization manager. Now, if we don't do what we have to do, and we fail, we're going to make her look bad. So do what we have to do. Make sure that we understand the message tonight and we practice what we need to practice to get rid of this thing that is coming back to haunt us. And you heard Dr. Jackson said it's going to be harder to deal with if it comes back. I don't know what polio look like. I don't know what any of them things. I only hear about it. Anyhow, it's not my night, so welcome back, Nurse Paul.
Good evening, everyone. Minister, thank you for coming. My presentation tonight is really going to be very short because all of the speakers before me would have given you the history of immunization. They would have spoken to you about the benefits of vaccination. You would have seen the impact from the lack of vaccination over the years. And you also heard of the achievements that we can boast of as a region that we have achieved over the years. We are proud to say that the region of the Latin America and the Caribbean has been leaders when we come to vaccination. We endorse the strategy, we believe in the strategy, and we have shown that it has worked for us for over 40 years. So the question is, why have we let down our guard and allowed these diseases now to be back into our region and threatening our region? So, as I said, I would not go too much into the history, but I must let you know that our region started this whole immunization program in the year 1977. So immunization or vaccination is nothing new to us. And really, when we started, you can appreciate that vaccine coverage has been very low. But with the implementation of vaccination, we would have carried ourselves through and reaching vaccination coverage over the years of over 95 to 100%. I wouldn't go into all of that, but I would go in directly into the threats of what is happening to our expanded program and immunization. So currently in our country, we are seeing some threats to the EPI program. What are some of those threats? we are seeing an increase in the number of anti-vaxxers in our country, something that we would say wasn't even aware of, was present in our society. One category of persons that was against vaccines years ago was the Rastafari persons. Now, we have these people on board. We no longer have to convince them of the importance. They have been convinced. But we are seeing other persons coming out and be anti-vax. We also have the threat of misinformation. Persons are being influenced by all different mediums, and we know our people now are very active and they're using a lot of social media. So we have a lot of misinformation on social media, and as a result, persons are being influenced by this misinformation and not willing to accept the factual information. So we are saying that some of our population is kind of losing the trust in what the health professional speaks, and they're losing it fast. We have vaccine hesitancy as well. And the hesitancy really comes about as a result of the misinformation, right? And one of the things that Dr. Donald spoke to earlier about the Public Health Act is failure by our institutions, we would say government, to really enforce the Immunization Act of 1980. And some persons may not see it as a risk, but I always have it as something that threatens our immunization program, high vaccination coverage. Why I say so? Because over the years, Grenada has been achieving over 90% of immunization coverage. And the region as a whole has been having very high immunization coverage. And as a result, we have not had these diseases that we saw earlier on in our region or in our country. And because of that, our people has become very comfortable, and now they have become very complacent. So we may see high vaccination coverage as a strength. It is a strength. It is our strength that we boast of all the time. But it is becoming also a threat to us. Yes? And if we continue on that line, what would happen, or what is happening currently? We are seeing a reduction in the acceptance of vaccines by the public. We are also seeing low immunization coverage. We are going to be seeing some significant public health and economic consequences. Because if we are to have measles in our region, the travel a lot goes out, not so? To let persons know Grenada have measles. So they are telling visitors, stay away from Grenada, because there is measles in Grenada, and measles is highly contagious, so as a result, you shouldn't be going there. We know that our country thrives on tourism, not so? That's where most of our income comes from. So if we were to have these diseases and persons are no longer coming to our shores, what would happen to our economy? What will we utilize to be able to sustain the healthcare system that this measles outbreak would be overwhelming, right? So this is some of the things as a result would happen. We have increased risk factors for disease outbreak, and that is because our immunization coverage is low. And if you do not have the coverage, then you're at risk for outbreak of diseases and all of the disease to which was spoken earlier. We have the risk of the reemergence of neonatal tetanus. This is something that our obstetric department would boast of. They have not seen this in decades, yes? And even we have the risk of maternal death returning to us.